Right, well today we're going to undertake a rhinoplasty using the Piezo ultrasonic technology. This is a relatively modern way in which we can move and shape bones without having to formally break them. And our patient's a very nice lady with a small dorsal hump who wants a smaller nose and a better profile.
She's marvelous, actually. She definitely wants a smaller nose, a straight profile, and to stop the tip downturning when she smiles. So she will also have the preservation technique together with the Piezo. Both are the most modern approaches to rhinoplasty surgery.
How are you? I'm Jimmy, the anaesthetic doctor. Lovely to meet you. Hello there. You must be Mum.
Yes.
Nice to meet you. How are you feeling?
Good, I'm nervous.
Nervous?
Thank you.
Oh, that's to be expected.
You're not having this done every Wednesday, are you?
So it's really important that everyone introduces themselves and we discuss the case. This is key. It's based on the WHO safety recommendations, so that there's clarity, delegation, and everyone knows their roles and responsibilities. And we've confirmed the patient and what's intended with all the equipment that's necessary.
Well, I look forward to seeing you. The surgeon will come and do your consent, Mr. East and Miss Badia, and then we'll get you down to theatre.
For Annabel, this is the day she's thought about for months. The decision made, the plan in place. Today, it becomes real.
I'm really scared actually about just the going under. I've done it once before, but it's just, it always feels strange. Yeah, just to see the final result and go through the healing process. But
for many patients, anaesthetic can feel like the most daunting part of surgery. In reality, it's a calm, closely managed process. Annabel is guided gently into a controlled sleep, constantly monitored by her anaesthetist and team. With Annabel now under anaesthetic, Charles and Lydia prepare for surgery. As they scrub in and set up, the operation begins, the first step in Annabel's transformation.
Now, we elected to do her surgery closed. All of the incisions are inside the nostril, so there's no external scar.
In theatre, the focus changes. This is where design meets discipline. The balance between Charles and Lydia is quiet, intuitive, an understanding built over years and years of operations. Annabel's unaware of the quiet choreography around her, but in this room, every moment is guided by the conversations she started many weeks ago, her hopes, her trust, her decision to begin.
With the new tips with the Piezo, we were able to do the bone release and drop her nasal pyramid with a dorsal preservation technique. And the Piezo allows us to sort of release the bone without formally breaking it.
We've now released the bridge and separated from the septum. And the preservation technique then allows me to move this mobile bridge. What I can do is just impact this down. And we see the hump magically disappears.
The operation was what we call a high strip preservation. The natural bridge and its slimness from the front is preserved, but the whole bridge is lowered. And then the convexity is stretched so that we can change the hump into a flat surface, and then that's fixed onto the septum underneath that's not really altered. And then to balance that, the nasal tip cartilages have to have some modifications, obviously with deep projecting, that is a nose that sticks out less far, changing the shape of the tip cartilages, but to keep a softness, not to make it sharp or pointed, but to make it then rebalanced with the new bridge position. And then finally, the length of her nasal septum was altered slightly, so her nose was slightly shorter. You know, the approach we choose is going to be the one that's going to give you the best chance of success with the least risk of a residual problem that might need you to have another operation.
As the final sutures are placed, the procedure nears completion. What began as planning and anticipation now settles into quiet precision, the foundation for Annabel's recovery. With the final sutures complete, the nose is carefully taped, supporting the structure as the first stage of healing begins. She will now be taken to recovery, where she will rest under close supervision, whilst the anaesthetic wears off.
Here we are, our patient's in recovery, and she is now waking up. When you come round from anaesthesia, you'll often feel like you've been in a long, deep sleep, and of course you'll have no recollection. But then as you become more conscious, the nurses will sit you up. We will often use some decongestant nose drops for you, and they will often give you a sip or two of water or some ice to suck. And then when you're ready, they'll transfer you back up to the ward, and that may take 45 minutes or an hour before they feel you're comfortable to return back up to your room.
How are you feeling?
I'm feeling absolutely fine. Thank you so much. There's like no pain or anything. She's really excited, so thank you. How did you find it? How did it go? Yeah?
I went really well.
Oh, that's so good to know.
And at the moment, have you any bruising? You look sensational.
Just incredible.
That is incredible.
Feeling good? Oh, it's a pleasure. Look really pretty at the end, really pretty. Everything that we said we'd do, we've managed to achieve.
That is so amazing. Thank you.
He's still a bit numb here,
Yes.
but no pain.
No pain at all. Like, I just feel fine, so thank you.
She's an amazing woman, and it's been such a pleasure to help her throughout her dream. She says truly that had been her dream for a long time. It's like it was the Annabel before and after, not just side by side before and after, but her life. It's lovely to see young women blossom in confidence after the surgery.
I can kind of see from the side that it's straight out, just getting so excited. I think I'll probably cry next, so you're doing away.
All emotions. Emotions are allowed.
Yeah.
Well, we'll see you next week. If you're next.
Thank you so much.
Bye, darling.
Thank you so much.
Bye-bye, and see you next week.
She's going to be a lovely example of what it is like to go through this operation with us.